Cervical cancer continues to affect women worldwide, and it is the second most common cancer among women in South Africa after breast cancer, and the leading cause of cancer deaths in women. The good thing is that this cancer can be successfully treated if detected early. Welcome to Edu-Clinique, and in this video we are going to cover the top 5 must-know facts about cervical cancer. And at the end of the video, we will answer one bomb question about cervical cancer, so stay tuned. Fact 1. Cervical cancer is the cancer of the cervix. The cervix is the lowermost portion of the uterus that extends into the vagina. 95% of cervical cancer cases are due to the human papillomavirus or HPV, and some cases the herpes virus. A lot of times your doctor might refer to cervical cancer as CIN, which stands for cervical intraepithelial neoplasia, and will grade it from 1 to 3 depending on the severity. Fact 2. The risk factors or factors that could predispose one to this type of cancer include exposure to HPV through sexual intercourse, long-term use of oral contraceptives, first intercourse at a very young age, suppressed immune system such as in HIV, and smoking. Actually, smoking is a risk factor for all types of cancers. Risk factors are not the causes, but rather conditions that increase the chance of developing a disease. Fact 3. The most common warning sign of cervical cancer is menstrual irregularities. These include prolonged bleeding, heavy bleeding, intermenstrual bleeding, which is bleeding in between periods, postmenopausal bleeding. Cervical cancer can also manifest in bleeding after sexual intercourse that is not due to an infection, pelvic pain, which is the area below your belly, lower back pain, and a foul-smelling discharge that is not due to an infection. Having these symptoms doesn't mean you have cervical cancer, but you should go get checked by a doctor. These are just the red flags. Fact 4. If detected early, it can be successfully treated. Cervical cancer can be detected through a pap test. The pap smear can be done together with the pelvic exam. During a pelvic examination, the doctor will look outside the genital area, and with the help of a speculum will look inside as well. A pap smear is able to detect precancerous cells even before they become cancer. If you would like to learn more about the pap test, please check out our video on pap smears. Treatment options can vary from surgery, radiation, and chemotherapy depending on the stage of the cancer. Fact 5. Cervical cancer can be prevented. Cervical cancer can be prevented through regular screening using the pap smears. Another form of prevention is through the vaccinations. A vaccination against HPV is the most effective method against cervical cancer. South Africa has a school-based HPV vaccination campaign which gives free vaccinations against HPV to girls in public schools with the signed consent of the parent or the guardian. And now for the bomb question of the video. Will I be able to fall pregnant after being treated for cervical cancer? Your ability to fall pregnant and carry a pregnancy will vary depending on what type of treatment you receive for cervical cancer. Early cancer that hasn't spread beyond the surface of the cervix can often be treated with surgical approaches that may preserve your ability to become pregnant and carry the pregnancy. Advanced cancer may require a hysterectomy, which is the removal of the uterus, and radiotherapy, which might not preserve the ability to fall pregnant and carry the pregnancy. Do communicate your concern about fertility with your healthcare provider. Edu-Clinique is a health education channel. Information that is shared here should not be used as an alternative to a healthcare professional's diagnosis, treatment, or advice. And that's it for this one. If you found this video helpful, give it a massive thumbs up, leave us a comment down below, and do not forget to subscribe to get more informative videos like this one. Till the next one, let's talk about it.